Good afternoon. Thank you for joining us at Talk to Tell MD. We had a slight difficulty. Um, Two people trying to navigate Instagram that are new to this business. But welcome. I am Toyin, Dr. Toyin, the CMD, which is the medical director at TellMD. And today I'm hosting Dr. Opelami, who is a nephrologist, and he will be educating us a little bit about the kidneys. Um, you can always send your questions as comments. We'll try to cover everything we can today. And if you have more, you can send them as messages or as comments as well. So, Dr. Palami practices nephrology in the United States. He has a lot of titles behind him, but he has told me not to talk about them today. So I'm going to leave the floor open to Dr. Palami to say hello.
Thank so thanks for inviting me, Tori. It's a pleasure to be able to join, particularly on a day like this where all over the world is celebrating World Hypertension Day. Not really celebrating, but marking World Hypertension Day. So it's just appropriate that we'll be discussing kidney disease on a day like this.
Okay, great. So you said kidney disease. What are the kidneys? What do the kidneys do? We hear kidneys. What do they do? What do they look like? Where are they? What are they?
So kidneys are a part of they're an important organ. The kidneys are an important organ in our body, and most of us are born with two kidneys. I always tell my patients that you've got kidneys about the size of your fist, and they sit in your back. I know that a lot of people will think about their kidneys about being lower down, but our kidneys are actually a bit higher up, and they're protected by our lower ribs. So they're actually two, usually about the size of your fist, sit in your back and protected by the lower ribs. Kidneys are really important. I tell people that they're probably one of the most important organs in the body because they clean the blood. I usually I tell my patients I have a glass of water next to me, but I tell my patients that really they're like filters. Our kidneys have about 1 million filters when we're born, and as we grow older, those filters, some of them age out, but generally we've got enough filters to last us a lifetime. And just like a water filter, if you had a water filter and you took a glass of water and realized that, oh, I'm starting to see some particles or some waste in my water, tells me that my filters are not working very well. It's the same thing with our blood. We generate waste every day just by being alive. Even if you do everything right, your body will generate waste. And one of the ways we get rid of waste from our body, from the things we eat, from the medications we take, from just being alive, from metabolism, one of the ways we get rid of some of this waste is through the kidneys. And so when the kidneys are not working very well, you start to see the waste build up in the blood. And that's when people talk about having kidney disease, that it means that the filters are either not looking right, so that we talk about structural damage to the filters or to the kidneys, or they're not functioning right. So those are two things I want you to remember. They're either structurally abnormal, meaning they're damaged from whatever thing going on with the kidneys, or they're not working right, in which case they're not filtering. Remember I said the kidneys are like filters. So when they're not working right, it means they're not filtering right, in which case you start to see some of that waste building up in the blood. So in a general sense, that's what the kidneys do. Great organs, the protectors, get rid of the waste. And when they get rid of the waste, when they clean the blood and get rid of the waste, they get rid of the waste as urine. So I tell people that you think about urine as wastewater. So your urine is actually a combination of waste and water. So when the kidneys are not getting rid of the waste, that waste goes back into the blood, and the water also starts to build up in the body after some time. So
Thank you.
that's what the kidneys.
Thank you for that explanation. So, how do people get kidney disease? Because you've said most people have two kidneys at birth, and I can imagine at birth they are new. It's like a new car. So how do people in their 20s, in their 30s, you hear that, oh, they have kidney disease, and it seems to be so rampant these days. In Nigeria, you hear that a 30-something-year-old person needs a new kidney. Why?
So, we think about kidney disease as two types of kidney disease, and they're like two different things in a general sense, even though we talk about them as kidney failure either way. But in certain situations, the kidneys just suddenly go bad, in which case you always knew you had normal kidney function. You've seen doctors, you've had blood tests in the last couple of months, and then the person gets sick from something, either from an infection or some heart disease, or someone gets really dehydrated or has something that causes a lot of bleeding, and anything that makes the body feel like there's just not enough blood or not enough water in the body. Kidneys usually suffer some damage from such things, or they slow themselves down. So we think about that as having what we call acute. I don't want to use the term so it doesn't confuse you, but that's something different. And most times when people have kidney failure, they have what we call chronic kidney disease. Chronic just simply means it's been going on for longer than 3 months. That's all it means. They have chronic kidney disease, and it just means that the kidneys have not been working as well as they should, or they've been damaged for longer than 3 months. Why do people get kidney disease? Particularly, let me focus a bit on the chronic kidney disease. Excuse me, let me get some water. Now, water is great. So, people get chronic kidney disease because they're at risk. Okay, and it's important for all of us to understand what puts us at risk for kidney disease. Of course, there are certain things we can't control. You can't control the fact that as we grow older, some of the kidney filters age up. But also, as we grow older, our risk for other things go up, particularly things like high blood pressure. All over the world, high blood pressure is the number one cause of kidney disease. Okay, close to that is diabetes. If someone has diabetes, the person is at increased risk of kidney disease. Okay, there are other things now. If in Now, like Tony introduced me, here in the United States, high blood pressure and diabetes are by far the two commonest causes of kidney failure. But when in Nigeria, you start to see a lot more relative to other parts of the world, a lot more of other things like certain types of inflammation affecting the kidneys. We call them big term you don't need to remember, but glomerulonephritis, which simply means that those filters are having some inflammation. And a lot of times, these things are related to infections, viral infections. So those are some of the things. Also, medication, some of the things that we expose ourselves to, particularly over-the-counter pain medications like the ibuprofens and naproxens. People take every now and again. I have a little bit of pain in my knees. Take some ibuprofen, and they do this on a regular basis. Over time, those things put people at risk for kidney disease. But importantly, there's the things that we're starting to learn quite a bit about in the last several years, and those are the genetic predisposition. Now we realize that particularly people of African descent here in the United States tend to have higher rates of kidney disease, and when they have kidney disease, they have more rapid progression of the kidney disease. And we're identifying particularly a particular gene type, which interestingly has a much higher prevalence in Western Nigeria. A lot of the data shown about 40% of people in Western Nigeria actually have this high-risk gene compared to 13% of African Americans here in the United States. So you're talking about 2 out of every 5 people having a gene type that puts them at high risk for kidney disease. People particularly in southwestern Nigeria. And so it's now not surprising when, like Tony, like you said, you see a 30-year-old suddenly saying this person has kidney failure. Where did it come from? Sometimes a lot of this has to do with the genetic predisposition to certain types of kidney disease. And that's why it's important to talk about it, to talk about how can we prevent it, how can we get screened, what can we do to avoid, or what can we do to treat or to slow down the progression of kidney disease if we have.
Thank you. Thank you very much. So, from what I heard you said diabetes and high blood pressure. So, I'm assuming it's uncontrolled diabetes and uncontrolled high blood pressure that might cause kidney disease. You said some medications could cause it, some infections could cause it, especially infections within the kidneys could cause it. And then you said some gene types, and that put me in a shock. I remember reading recently it was a study looking at a particular state in southwest Nigeria, and it was a study looking at motorcyclists in that state. And 1 out of every 4 had CKD. That's chronic kidney disease. And I was like, this has to be, it has to be an error. But now you tell me there's a gene type that actually predisposes people, and from the southwest of Nigeria too. Well, that means you should see your doctor and get screened and make sure you're keeping an eye on your kidneys all the time. So we now know why. What can make us have kidney disease? Would you be able to tell us how we can prevent this?
So let me start from where you started from just now, talking about uncontrolled diabetes and uncontrolled hypertension. But that's assuming that the person knows that he or she has hypertension or diabetes. Unfortunately, a vast majority of people with high blood pressure, which is hypertension, or diabetes, high blood sugar, don't even know that they have these things. Okay, so we always talk about diabetes, for instance. We say, okay, um, people start to develop kidney disease when they've been diabetic for about 10 or 15 years. But we also know that most people with type 2 diabetes don't know that they have diabetes for about 7 to 8 years. So they would have been having this high blood sugar such that by the time you're making the diagnosis of diabetes, they are already at risk for having kidney disease. Okay, not to talk of starting to control it. Same thing with high blood pressure. Um, Growing up, and even up till now, people talk about high blood pressure or hypertension as being a silent killer. It's a silent killer because there are many people walking the streets who have high blood pressure and they don't know it. So the only time we can talk about controlling high blood pressure or controlling hypertension, controlling diabetes, is when we know that we have these conditions. That's why it's critical that people get checkups.
And
Okay, after the age of 18, every adult should at least have a blood pressure check. Over the age of 40, every year should have blood pressure check. Diabetes, after the age of 35, you've got to have it, particularly when there is a higher risk in people who are overweight or obese or have a family history. You've got to get checkups. Just preventative stuff. You need to know your risk, and then we can talk about preventing it. Go ahead, Tommy.
I like that you've emphasized getting checkups. A lot of Nigerians, I would always say, they're mostly reactive and not proactive. So it's when complications set in, they start discovering that, oh, I do have diabetes and oh, my kidneys have been affected. So I'm going to re-emphasize what Dr. Pelami just said. Go see your doctor. You're over the age of 18. See your doctor at least once a year. You can come see people at LMD. They have great doctors. Once a year, be screened. Check your blood, check your urine. Let them check your blood pressure. Do you have high blood pressure? Do you have diabetes? And if you do, it's not something you should keep to yourself or say, I want to manage it at home. Even if you want to manage it at home, let your doctor know what you're doing. Let them give you a check mark and say what you're doing is working and is working well. Do you have your blood pressure monitor? Do you have your blood sugar monitors? That's the only way that you can know that what I'm doing, what you're doing at home is working. Or how are you going to be using all the concoctions some people would advise you to use and you're not checking? Is this working? is this working? So I recommend, I advise. Most people that know me, that are close to me, they will hear me say this all the time, at least once a year. Sorry I interrupted you. I just had to re-emphasize that. Please continue to educate us on what could cause kidney disease. Or no, we've gone to what we could cause, how we can prevent having kidney disease. You've talked about high blood pressure, you've talked about diabetes. Please go on.
Yeah, so again, I tell my patients all the time, if there's one thing that you can do to slow down progression of kidney disease, it will be controlling those risk factors, particularly high blood pressure, Now, the other thing is to avoid the things that can help the kidneys. Now, there's been data, usually out of Nigeria or out of Africa, there's when we're looking at risk factors for kidney disease, one of the things that always comes up, the association with traditional medicines or traditional, I don't want to use the word concoctions because that puts them in bad light, but there's some of the
It's
things
called
that we,
agbo. Agbo. That's in my language.
yeah,
Please
those
go on.
things, again, I think that there's some benefit to plants and things of nature, but sometimes some other things get mixed into these plants and herbs, and there's some of the herbs that actually could be toxic or dangerous to the kidneys or to overall health. And so when people ask me, "Oh, what do you know about this?" Like, hey, I don't know enough. There's some of the herbal things that we can look up, that there've been studies done on them, that we know what they could cause in terms of risk and benefit. But I tell people as much as possible, you want to avoid the things that you don't know enough about. The other thing to avoid will be the over-the-counter pain medications as much as possible. Okay, of course, if you have some back pain, yes, couple of days, 3, 4, 5 days, that's okay. But regular use, daily use of these over the counter, we call them NSAIDs or non-steroidals, ibuprofen, naproxen, Aleve, Advil, those things can be dangerous to the kidneys. It's also important to lose weight if you're overweight or obese, because independent of the association with diabetes, um, obesity is associated with certain types of kidney disease. So losing weight is helpful. But again, it's just the general things, improving your health. I'm going to go back again, hypertension. If you're diagnosed with hypertension, taking your medications, and if you, apart from taking medications, we talk about things that are also helpful in lowering blood pressure, like watching the amount of salt in our diet, okay, regular exercise, stopping smoking. Stopping smoking helps everything. It helps blood pressure, helps kidney disease, helps with heart disease. And so that's important because certain types of kidney disease also are associated with cigarette smoking, independent of the association with high blood pressure. But now, when someone has kidney disease, there are things that we try to do. One is make the diagnosis of the kidney disease, find out why they have kidney disease. Are some of these things reversible? If they're not reversible, then the important part of it is now managing those things. I tell my patients, sometimes you know that the horse is already out of the barn. What you want to do is to slow it down. You may not be able to stop the train, but you can slow it down. Because what you don't want is for kidney disease to continue to get worse to the point that the patient needs dialysis, or to the point where the kidney disease starts to get associated with other things like heart disease and increased risk of death. Thanks,
Thank
Tony.
you. Thank you. Thank you for telling us, teaching us, educating us a little bit more about how we can take care of ourselves, how we can prevent kidney disease. But you didn't talk about drinking water. Is water not important? How can what is it actually true? Some people will say I drink about 6 to 12 bottles of water daily, and yeah, you see them still have kidney disease.
All right. I'm going to tell you this, okay? Unfortunately, drinking more water than your body needs does not necessarily, does not improve your risk, does not lower your risk. um, our body actually doesn't need as much water as we think. The two categories of people with kidney disease that need a lot more water. Okay, for most of us, 1.5 to 2 liters of water a day is appropriate. Okay, we'll be fine. I tell people, look, there are two reasons why we drink water. One is that your body needs a certain amount of water to stay alive. The other part is a habit. Okay, there are people who don't drink a lot of water and they're fine. What's just going to happen is that your urine is going to be more concentrated. If you drink more water than your body needs, guess what? Your urine just gets very dilute. Yes, it's going to look like, oh, my urine is very clear. It doesn't mean that your kidneys are doing better. They're just peeing out water that your body doesn't necessarily need. The two categories of people that need more water generally are the people who have kidney stones. Okay, when someone has a history of kidney stone, we tell them to drink at least 2 liters of water. The other group of people are people who have certain kind of kidney disease that we call polycystic kidney disease, in which the kidneys form these abnormal cysts, like ballooning out of the kidney filters, or ballooning out of the kidney tissue. So those people, and it's a genetic thing that they have, and those people, we tell them to drink at least 3 liters of water to slow down the rate of kidney cyst progression or enlargement. But apart from those people, you really don't need to drink more than 2 liters of water. Okay, people talk about drinking, oh, I drink a gallon of water. Sometimes it's a fad. I know people have these huge water bottles, and it's okay. Now, if you're doing things that are strenuous and you're losing water, you want to make sure you maintain the hydration. If you're exercising vigorously, yes, drink more water. But if you're like most people, you go to work, you sit down, you come home, hang out with your kids, yeah, you're not exerting yourself, you're not losing water, so you're not likely to be dehydrated. For most of us, it's an in and out, it's a balance thing. The amount of water you lose is the amount of water you drink, and really that comes out to about 1.5 to 2 liters a day. So that, for most of us, should be okay.
Okay. Thank you for highlighting this. So, how do we know we have kidney disease? I've seen so many articles, or should I say write-ups or things on WhatsApp. I've heard some myths. Some people say if you taste your urine. Some people say if you pee, you will see the foam. Some people say all sorts of things. How exactly is it diagnosed? How do we know?
Please don't taste your urine. It's wastewater, okay? There's nothing you're gaining from drinking urine, okay? Now, the only way to know that you have kidney disease is by testing. Um, Blood test, urine test. Okay, those are the two things. Because the blood test will tell you, like I told you, that the kidneys are like filters, right? The blood test tells you how much waste is in the urine. Particularly, we look at something called creatinine, which really is a waste product from muscle breakdown. Now, we use that to give an estimate of how well the kidney filters are filtering or working. That's how we test the kidney disease. Now the second uh, thing is the urine test, because sometimes the kidney filters may still be working and cleaning such that it looks like they're cleaning well, but the urine test may show that there's already some damage happening, like people having a lot of protein in the urine, which is abnormal. Okay, over time, the filters stop working well. So sometimes for people, it's like those water filters get leaky, and protein is good stuff that you want to keep in the blood. But for some people, those filters, when they get leaky, you start to see some of that protein in the urine. This may predate the onset of the what we call kidney failure. But it's important when you catch that early from the urine test, then there are interventions and things that can be done to actually help slow down that protein in the urine so that your risk for kidney disease is better. Now, it's just testing, blood tests, urine tests. Now, to your point about foamy urine, we always talk about it, but yes, sometimes when people have a lot of protein in the urine, the urine gets foamy or bubbly. Some people it's like having some frothiness in the urine, but you can't use that and say, oh yeah, my urine looks normal. that doesn't mean that there's no protein in the urine. So really, the message is just get tested. The people who are at risk for kidney disease should get tested and screened for kidney disease. Okay, people with high blood pressure, with diabetes, and with a family history should get tested every year with a blood test and urine test to screen for kidney disease. That's really the only way you're going to identify it, and it's critical. Early detection helps. Early detection helps. When, unfortunately, a lot of times when the stories that we hear, people who they tell you, oh, they suddenly had kidney disease. No, most times people don't suddenly develop chronic kidney disease. It's been going on for a long time, and then they find out when they start to have symptoms, when they start to get sick, which is when the kidney waste level is actually at a much higher level, in which case you've lost the opportunity to actually slow things down, or even to 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 turn back whatever was going on if there was a possibility. And that's why people end up on dialysis, or they need a kidney transplant, or they just develop other complications like heart disease from the risk of kidney disease. Now, testing, it's a simple blood test, a simple urine test. If you know that you're at high risk or you have diabetes and hypertension, make sure your doctor is checking your blood and screening for kidney disease. Make sure your doctor is checking your blood, your urine, and screening for kidney disease. Now, when people have kidney disease and kidneys are working less than about 30%, or there's a lot of protein in the urine, then that person should see a kidney specialist, a kidney doctor. Those are the things that we can do to help prevent kidney disease, to help slow down this almost getting to just there's such a high prevalence. And I was looking at some data recently, and up to over the age of 60, we're talking about almost 1 out of every 3 to 4 people over the age of 60 years in Nigeria have chronic kidney disease. That's a lot of people, and majority of these people do not know that they have kidney disease. It's important to know because the certain medications that we know help in slowing down progression of kidney disease. Because at the end of the day, that's what we want. There's some things we can't change. Sometimes you just can't change the cards that are dealt. Yes, you've got diabetes for so long, there's a family history, but when we find out that there's kidney disease, the interventions, the medications, they can help slow down the progression of kidney disease.
Thank you so much. Um, I know a lot of us will have follow-up questions from this. If you have questions for Dr. Opalami, you can reach him by going on telndng.com. That's TELMDMDNG.com. Or you can call on 0707-660-7330. That's 0707-660-7330. So you can reach him that way if you have more questions for him concerning the kidney disease, what we're talking about. So I've heard him say 3 reasons why you should see your doctor every year. Not necessarily your kidney doctor unless you've been diagnosed with kidney disease, but your regular primary care doctor, your everyday doctor. You need to check your blood pressure once you're over the age of 18. You need to get screened for diabetes. You need to know what your diabetes, your sugar numbers are. And now you need to get your kidneys checked. And I would recommend you do this at least once a year. When you do this once a year and your doctor says, you're perfect, see you next year. So this is what I would recommend. So he has told us what the kidneys are. He has told us what the kidneys do. He has told us what kidney disease is. He has told us why people have kidney disease. He has told us how people get diagnosed with kidney disease. He has told us how to prevent it. Now we want to know, how do we treat kidney disease? Is it treatable?
Yes. Simple answer is yes. There are many types of kidney diseases that are treatable. Um, Again, I'm not going to go into the details that when someone is diagnosed with kidney disease, it's not the end of the world. Uh, it just means you need to see someone to say, hey, what can we do? Um, Most of the people who come to see me come to see when they hear that they have kidney disease, they come to see me because they're worried about two things. One, they're worried, look, am I going to die from this, or am I going to end up on dialysis? Those are the two things. So, am I going to die? Am I going to end up on dialysis? And again, it's not a diagnosis of kidney disease is not a sentence, not a death sentence. Okay, because there's so much that is available to treat kidney disease. Now, kidney disease is not one diagnosis. So people have kidney disease because of this. So we say kidney disease secondary to this, kidney disease secondary to hypertension, kidney disease secondary to diabetes. There's some types of kidney disease from things like some autoimmune conditions or kidney disease from things like multiple myeloma. I'm not going to go into those diagnoses, but some of those things are treatable such that when you treat the cause, then you can reverse the kidney disease. People, for instance, when people have kidney disease from hepatitis C, treating the hepatitis C is the treatment of the kidney disease. When people have kidney disease from things like HIV, treating that does treat the kidney disease. Or some other types of what I call the inflammation of the kidneys, glomerulonephritis. Okay, treating those conditions are things that can be done. But things like hypertension and diabetes, it's more about managing it. Okay. You may not be able to reverse what's going on, but you can slow it down by treating the blood pressure, treating the diabetes. But also we can add on certain types of medications that we know that have been shown to work in slowing down the progression of kidney disease. Because at the end of what the people are worried about is, hey, I don't want to end up on dialysis. I'm saying, hey, these are the things we can do so that instead of the slope going down like this, I can get the slope to do these so that your kidneys can last you a long, long time. But the times that despite our best efforts, people's kidneys get worse, they end up and need dialysis. Dialysis is when people need to have a machine to clean the blood. Remember I told you that the kidneys are like filters. When those filters are not working and the waste level is building up to a point where it's starting to make the person sick, you've got to find a way to get rid of the waste. Now, of course, the best way to do that is to get another kidney, in which case, get a kidney transplant. But not everybody will be able to get a kidney transplant. One is available? If it's not available, um, can we get it somewhere else that it's available? Well, sometimes even when it's available, the person may not be a good candidate for kidney transplantation. So there's got to be that availability. There also has to be the affordability. In some places, kidney transplantation is not it, it's not paid for by health the insurance system. I'm not too sure whether the health insurance system in Nigeria pays for the cost of kidney transplantation. But again, that's the best way. But if you can't get a kidney transplant and you get to the point where the kidneys have failed to the point where the person is now sick, what we call end-stage kidney failure, then the patient needs dialysis. Dialysis is a way of we can clean the blood by getting the blood through a filter, either through a machine or for some people they do it through the belly. We use I don't want to get into technicalities of that, but there are different types of dialysis when people get to the point where the kidney failure is so bad such that it's starting to make them sick.
Thank you for explaining a little bit about dialysis because when people do hear about dialysis, they are convinced it's a death sentence. On the other hand, some people are told your relative needs dialysis and they think that the dialysis would cure the kidney disease. So you telling us dialysis, I think I heard you say so. Dialysis is just like an interim fix while you get a transplant. Is very explanatory. So can you live your whole life on dialysis?
So I like that you
That
asked the question, can you live your whole life? Um, Unfortunately, living on dialysis will not be a whole life because life expectancy on dialysis is a lot less compared to someone who gets a transplant, someone who doesn't have kidney. So really, it's not a whole life in the sense of life expectancy, and also in the sense of quality of life and mobility, and just, I mean, getting attached to a machine is not ideal. But unfortunately, for some people, that's the only way to live. So it's life sustaining. Um, yes, they go and get dialysis and get the blood cleaned 2 or 3 times a week. They go to a center, they draw the blood, run it through a machine that cleans the blood. Do I have patients who have been on dialysis for 20 years? Yes, but it's not a whole life. Well, fortunately, for some people, that's all that will be available to them, either because for some reason, either their health situation, they cannot get a transplant, or for some reason, they cannot afford to get a transplant wherever community that they live. And so they just need to be on dialysis. It's unfortunate, but some people, they have to live the rest of their lives on dialysis.
Thank you for saying that. So I'm going to paint the picture again. You do not see your doctor. You don't know if you have diabetes or high blood pressure. Unfortunately, one of those things are happening, the silent killers, and you start seeing the legs swollen, and then you go to the hospital and they say, "Oh, your kidneys are not working," or "The kidneys are not working. There's a need for dialysis." And then everybody starts running out of skelter, dialysis, dialysis, and you two or three, and the money is drying up, and they say, no, that's not the end, it's not a fix it. You have to still continue until you get a transplant. Unfortunately, I do not think the Nigerian insurance system pays for transplants. And even if they did, there are still medications you would use every day because of the transplant. There are medications that would help your body not reject someone else's tissues that have been placed in you. So those two cost money. So I hope you can appreciate the picture I'm painting. Prevention is better than cure. This reminds me of this debate we used to have when we were children in secondary school, and you always end with, my point is made. Prevention is better than cure. But that's the fact. It's better to be proactive and get diagnosed and get treated for all these chronic diseases before complications set in. Thank you so much, Dr. Opalami, for coming to talk to us. I can see a question or two coming up. And if you do not mind, if you can spare us a few more minutes to answer them, and I would encourage other people, if you have questions, you can put them in the comments, or you can reach Dr. Palami um, on telmdng.com. That is telmdng.com. Or you can make a call on 070 660. I feel like I'm giving the wrong number. If you go on telmdng.com, there's the WhatsApp icon, and you can click on it, and it will help you make a call through WhatsApp or help you send a message through WhatsApp, and you can reach Dr. Palami that way. And of course, you can also get your yearly screening on Telendi, meaning you can get your blood pressure checked, you can get your diabetes numbers known, you can get to know your kidneys, yeah, they functioning well. So you see the doctor does all these tests that are personalized to you, and then you come back again to see the doctor, and they discuss the results of this test and make referrals as needed. So it's always better to see your doctor at least once a year. So I'm going to read
Well,
out the
can I
question I have
piggyback on
here.
that real quick?
Sure.
Again, I'm going to stress it again, what you just said. It's really important. Think about it as health care, okay? Not sick care. Don't wait until you're sick. When people say, I'm going to see a doctor, you're wondering, oh, is something wrong? No, don't wait until something is wrong. That's the whole point. You want to make sure that you're staying healthy and not when you're sick to see a doctor. Yes, we get sick, we need to see doctors, but start with making sure you know where you are, you know your risks, you know, and every adult, you know your blood pressure. Okay, over the age of 35 years with risk factors, make sure you check in. Just get an annual check. Just get a one-time annual check. Okay, and then we'll see what your risks are. Know the need for further testing. I'll go ahead, Tony. Questions.
Okay, great. So I have a question here. Is nephrotic syndrome a kidney disease already? And why does a young girl of 13 years have the syndrome?
Great question. Yes. So without going into nephrotic syndrome, and the word syndrome just means a constellation of different signs. Okay. So there are about 4 or 5 things that will make up nephrotic syndrome. But the bottom line is that that person has the kidney filters are very leaky, such that they have a lot of protein in their urine. Okay, the filters are leaky. They have a lot of protein. Okay, over at least 3 grams of protein in the urine, and because of that, they're losing protein from the blood. They start to have some swelling in the legs because their body starts to hold on to too much salt water. And sometimes, particularly for kids, the swelling is not just in the legs, but sometimes they have puffiness of their face, swelling in the belly. And so that's what nephrotic syndrome is. There's some other things like the cholesterol could be high. When you check the blood test, the protein in the blood is low because you're using up a lot of the protein by the liver. But the point is that that's already kidney disease. Now, a lot of times in younger people, the nephrotic syndrome is because of certain abnormalities that are happening in the kidney. Okay, not because of high blood pressure, not because of diabetes, but certain things are wrong in the kidneys. And when they have those things, the only way they make the diagnosis is by doing a biopsy. They take a piece of the kidney and look at it, and then get a sense of what's going on and how to treat it. Most times with kids, though, the number one cause of nephrotic syndrome, something called minimal changes. And I'm not a kid doctor, I'm not a pediatrician, I'm an adult kidney doctor. But a lot of times, those types of kidney disease can be treated. Can be treated. Sometimes, yes, they have some relapse, but those things can be treated. But yes, nephrotic syndrome is kidney disease. Sometimes with nephrotic syndrome, like I said earlier, the 2 things to think about with kidney disease, it's that there's structural damage or the kidneys are not functioning well. With nephrotic syndrome, many times it's the structural damage, but after some time, then you start to have poor function, in which case the kidneys are actually not even cleaning very well, and that's a bad sign. But yes, to your question, nephrotic syndrome is already kidney disease. Now, for adults, there are many causes of nephrotic syndrome. Probably the number one reason people have nephrotic syndrome all over the world is diabetes. But there are other causes of nephrotic syndrome, infections, hepatitis B, hepatitis C, malaria is associated with nephrotic syndrome, HIV infection, certain types of exposures to certain toxins um, can expose us to nephrotic syndrome. And that's why sometimes when I talk about some of these mixes and herbal concoctions, that you don't know everything that is mixed into it. We know that certain toxins are associated with nephrotic syndrome. But generally, we talk about diabetes and as causes. But there are many things that will cause nephrotic syndrome that we don't know. But when we do the biopsy or take a piece of the kidney, then it gives us a sense of what else could be going.
Thank you so much for that answer. And if there are more questions coming in, I will read them out to you. But like I said, you can reach Dr. Opalami at 0707-660-7330. That's 0707-660-7330 or on telmdng.com. So if you could, in 1 minute and in 2 breaths, give us a summary of what you've told us today about the kidneys and what we need to do to keep our kidneys for as long as we live, I would appreciate it. And I'm sure everybody listening would appreciate it as well.
Okay, 2 breaths. I think the message here is that most people with kidney disease will not know it unless they get tested for it. Most people with kidney disease will not know it unless they get tested for it. And when you think about the fact that over the age of 60, 1 in 3 to 4 adults over the age of 60 have chronic kidney disease. but generally in the adult population in Nigeria, the prevalence is somewhere around 10 to 25%. So you could have up to a quarter of adults walking around with kidney disease and they don't know it. The commonest causes of kidney disease are high blood pressure, diabetes, and certain types of inflammation in the kidneys associated with infections that are somewhat prevalent in Nigeria. So it's important to see your doctor, test for high blood pressure, check for diabetes. And if you have these conditions, make sure they're getting treated. I know that we want to try other things. Tell my patient that's okay as long as those things are not hurting you. But there's nothing wrong in trying other things, okay? Yes, you're trying everything else. You're trying diet, you're trying those things. But if you need to be on medications, please make sure you're seeing your doctor and you're taking your medications. But the message, if there was one message, is regular checkups. Regular checkups. Don't wait until you're sick, okay? Go see your doctor as an adult, get regular checkups, and just know your risk. Thank you.
Thank you so much, Dr. Palami, for the time you've spent with us today and for the information you've passed on to us. I'm sure more questions will come in and we will be able to direct them to you if you do not mind. And like I said, you can reach Dr. Palami at telmdng.com. That's telmdng.com. And you can also reach him at 0707-660-7330. You can leave some questions here on the comment section. When we see them, we can pass them on to him as well. And like I said, if you go on the website and you click on the WhatsApp icon, you'll be able to chat with people who will direct you to Dr. Pelami. So thank you for the time today again. And like Dr. Pelami said, um, today is World Hypertension Day. So get to know your numbers. Check. Do I have high blood pressure? Talk to your doctor about your blood pressure. Oh, I see one more question. Do you have time for just one question? Okay,
Sure.
let me ask. What tests do you do for kidneys health?
There's not one test. So again, the only way to diagnose kidney, in terms of screening for kidney disease, it's a blood test and a urine test. So there's we call it metabolic panel that includes things like the kidney waste. Some of them called urea or blood urea nitrogen or BUN. You may have heard those terms of creatinine. Or it also includes other things like your electrolytes in the blood. But it's a bunch of tests that come together under the heading of a metabolic panel. That's the blood test. The urine test is just a simple urine analysis, and also checking the amount of protein in the urine. We call it the urine albumin, and they usually check it with a urine creatinine. For those tests, your doctors will know what tests to order. It's a simple blood test, a simple urine test to see how well the kidneys are doing. And those things are important to be checked every year in people who have high blood pressure, who have diabetes, or who have a family history of kidney disease. Because those are the people that are the highest risk for having chronic kidney disease. That's really important.
Thank you so much, everyone, for joining us today. Thank you, Dr. Palami, for talking to us about the kidneys. You can join us again. I think we'll be talking to Dr. Jaya Simi, who is a renowned hematologist oncologist, in 2 weeks' time, and he'll be teaching us a little bit about the blood and blood diseases and some cancers. So, come join us again at Talk to Tell MD in about 2 weeks' time. We would make sure we announce in time so you can join us and learn a little bit more about your body. So thank you, Dr. Palami. Thank you, everybody, for joining today. Have a great rest of your day and evening.
Thanks, Tony. It was a pleasure.